Hello, I'm Dr. Vissio from Briar Patch Veterinary Hospital, here today to talk to you a little bit about the ins and outs of laboratory or blood work for your dog. We have Jet, my assistant here. He'll be helping by asking some questions about blood work, laboratory work, and why doing that is so important for the health of your dog.
Dr. Vissio, why might my dog need lab work?
So lab work is very important for helping us determine the type of illness your dog might be having when they're sick. So it helps us define if they have an issue with their kidneys, their liver, pancreas, if there's any electrolyte abnormalities, and also very important to check for any signs of systemic infection or inflammation. Also helps us detect anemias, autoimmune disease, many different illnesses to help direct our course of treatment. It's also great on an annual routine basis, so we have data from which to compare if your pet does get sick. So there are many uses. Dogs can't talk to us. We do our best. We can tell a lot from a routine physical exam that can help guide us, but sometimes symptoms and or physical exam are very vague, like there's not enough information to narrow down the broad list of possibilities. So lab work is very, very helpful at helping us narrow down to get to a better and more efficient treatment course.
What are the different types of lab work and how are these tests done?
So there's several different types of lab work, many of which we can run actually in our hospital and get you answers right away. So a urinalysis, we can check if there's a UTI, if there's crystals or potentially bladder stones. That can help give us a signal to then go look with an ultrasound or do some type of imaging. It can also help us, dispense antibiotics or anti-inflammatories for your pet. In addition to urinalysis, there is blood work. So we have a complete blood count. That's the red blood cell, white blood cell, platelets. That's telling us things about infection, anemia, platelets. Could your dog have a bleeding disorder? Is it a tick-borne disease? That's treated differently than an autoimmune disease. So looking at the cells themselves through the automated machine, but also we have the ability to do a blood smear where I just put it on the slide and directly look at it under the microscope myself. That is also hugely beneficial. There's blood chemistries that goes over all the internal organ functions, which we'll expand on in just a minute. And then cytologies. Cytology is really by taking a sample of cells from the skin, either just directly as an impression smear and looking at it under the microscope, or by sticking a needle into a mass to look at a sample of cells under the microscope. There are some that are really easy to diagnose that have very characteristic patterns. Others can fall into a category, but you need extensive training to be able to narrow down those possibilities. So we might talk to you about sending that to a pathologist that really looks at cells all day, every day, so they are much better trained to give more specific answers. There's biopsies. Biopsies would be a sample of tissue that we would take and send off to a lab or a pathologist to take a look at, and that can really give more definitive answers about a mass, skin issues, if there's a lot of dermatitis and we just haven't been able to get on top of it or figure out what the underlying cause is. That tissue sample can be immensely helpful.
Why are routine blood tests important for my dog?
Routine blood tests are awesome. They are super helpful at giving us from like an annual basis, as your pet grows from being a young healthy dog into an adult and especially into a senior, it gives us a baseline for what your dog's normal is. Some dogs hang out right in the middle. That's super easy. Some dogs are going to hang out at the low end or the high end. All of these normal ranges are based on a huge population of dogs. So it helps us if your pet does get sick. If there is a value that's twice what it normally is, it may not show up outside the normal high end. It may not show up as abnormal, but if I have values for your dog going back 3 years that their level is always 45 and now it's 90, that could be a really helpful clue as to what's going on. It also really helps us trend things. So we never want to, our goal of medicine is do no harm. Most medications do come with side effects. Our goal is to always implement those medications or treatments at the most appropriate time. So it may be that we're starting to see some trends or elevations. It's really important that we keep track of those so that we time the implementation of a treatment or medication at the time when we can maximize the benefits and minimize the side effects. So trending stuff on either an annual or a 6-month basis is really helpful, especially if your pet is already on medications. Again, no medications are benign. They can be extremely helpful, but it's really important that we monitor those closely, even if they've been on those medications for a really long time without any issues. We have seen issues develop. Oftentimes with routine monitoring, we can catch a problem before it really becomes an emergency visit at the ER. So we believe very strongly in routine lab work here.
What do the chemistries mean on my dog's blood work?
Chemistries are great. Chemistries are, we call it blood chemistry because it's oftentimes enzymes or products that the organs give off. So the liver has enzymes that it secretes, but it also has proteins that it produces. So let's say for the liver, for instance, there are several different things we look at on a blood chemistry. There's ALT, ALP, GGT. They come from different places. Some of them will come from the liver parenchyma itself, so like the body or the tissue. Others are going to come from the biliary tree or the lining, the tubes that run through the liver and deliver bile. You're also going to have liver that produces albumin. It's going to produce cholesterol, so we look at those values as well. When you have the kidneys, I mean, with the liver and the kidneys, the main thing that they do is filter the blood, filter the waste, and try and get that excreted. So what we can see is if they're not functioning very well, those levels will rise. The things that they are normally supposed to excrete will start to build up, and those can have toxic side effects, and those are the markers that we're looking for. So you're always looking kind of for different patterns. One value in and of itself may be very important or not so important. You need the pattern or the mixture of different signals coming together that will really kind of raise a red flag or lead us down a certain path. So that's something that we always kind of interpret, not only the numbers themselves, but also in light of what your pet is going through.
For my last question, why is early detection and diagnosis of dog illness using lab work so important?
I think it's so important just because it goes back to what we reiterated before, is that dogs and cats, some may be more sensitive, but others can be very stoic. They're not going to always cry or limp or have a really obvious behavior when something is wrong. We can't ask them questions. It's really hard to say it hurts here or I haven't been feeling off. We use lab work to help us prevent serious illness, to treat serious illness, but that routine lab work is really what helps give us more information early on before things really become a problem. Sometimes we find things we don't necessarily expect and can treat and can avoid, catastrophic situations. Other times there may have been symptoms going on for a while. We haven't really been able to figure it out until we finally see that blood value change, and that's been something we've been suspicious of, and then that helps give us the impetus to really go after it and help them. All right. As always, we're always here to answer any questions, so please let us know. I hope this has been helpful. Thank you again.